Hey, this is Lauriston Crockett, your pet anti-aging expert, sponsored by The Gift for Life, and I'm so happy to be here with the famous pet vet, Dr. Danny Cox. Danny, how are you?
Doing great, Lauriston.
You and I have been talking about this video and been getting so much information, and people have talked to us about spaying and neutering, and they really don't understand that the harm that it can do to the endocrine system, and a dog only producing about 1% of the hormones. And we know from the study from University of California, Davis, that there are some health issues that can come on when you spay and neuter. And so we've been looking for another way. Now, we have an overpopulation of pets. We know this, but we also want to take care of them, especially with me about longevity and anti-aging. This is definitely a specialty that, is close to my heart. And I know it is to yours also, because you have to work with these animals that have had the spaying and neutering. So I believe that this new technology that you've told me about should be found out by everyone. So let's talk about it. It's called Zinc Neutering. So I actually got contacted by Officer Brenda, and everybody remembers Officer Brenda from Wiley Police Department, is that I used to work with one of her dogs, Carlo, and Carlo was about to be retired at 5, and I was able to keep him on the job using the Gift for Life until he was 9 years old. Now she's training 2 new police canines, and they're about, what would I say, Danny, about a year old?
Yeah, right at it.
About a 90-pound and about 100-pound German Shepherds, and they're absolutely beautiful. When I saw the video, the 2 Shepherds were brought into the shot spot in McKinney, Texas.
Absolutely.
And so I want everybody to remember that. We're going to give you more information about where you can actually have your pets done. So they actually brought the Shepherds in, and it looked like such an easy procedure. So you brought them in, understand that you weighed them. And what was the reason for that?
Well, we have to have an exact weight so we can dose the medications. The medications, albeit they're sedatives and not full-on blown anesthetic, we still have to have certain medications. We use some opioids in connection with them so that we can mitigate their pain, their discomfort associated with just being stuck with a needle, to be honest with you.
So instead of the possible side effects actually putting a dog completely under with a surgery, you basically, when you come in for zinc neutering, they're put into a twilight sleep, aren't they?
Yes,
a very light sedation.
Right, and it's and they don't feel what's going on really. They have senses. They can sense things, and you can talk to the dogs, and they won't respond, but they can hear you. So we
Well, that seems like a whole lot less side effects. So
oh yeah.
So let's talk about it. So the sedation is given to the pet or the police canine, and actually you have them on the table already. And so let's see what's actually taking place.
Okay.
So Danny, here we are. So we've got one of those beautiful Shepherds on the table right there. It doesn't look like a whole lot. They're in a twilight sleep. I don't even see anything strapped down, and you're not even wearing any rubber gloves. It looks like a lot of sterilization is going on. Is that not needed?
Well, no, it's not needed. It's there's no cutting, there's no incisions, there's no invasive procedure at all here. It's simply an injection. We just have to have the dog still. We have to have them immobilized for a short period of time, and so that we can manipulate that testicle and get the injection right where it needs to be. That's the big thing, is it has to go into a certain area of the testicle, in the center of the testicle,
right.
But it goes in from the cranial pole or the front of the testicle right at the caput epididymis, which is identify that location. We put the needle. The needle is a simple, small, little Botox-sized needle. What they use to administer Botox.
I was about to say, that is a small needle, so it
Right.
doesn't, I mean, this looks so easy.
It is. And the key here is we inject each testicle, and you can see the pet's kind of twitching there. That's just from the noises that he hears.
Well, it looks like he's taking a nap.
Yeah, he is taking a nap, and he'll hear some noises, and that stimulates his inner ear and his nervous system, and he'll jerk, but he's not feeling anything. He has no sensation of discomfort here at all.
Well, this is so simple. You don't even have a surgical light on here. You're just hands-on.
Right.
You've got a small needle. We're not cutting. We're not castrating. We're not putting the dog in any type of jeopardy at all.
Because it's not sterile. It's not a sterile procedure. I wash my hands, I disinfect, and all of our materials, our needles, or anything that's inserted in, you'll see there that it's being inserted slowly into a certain area of the testicle, and then we slowly inject the product. Hold the syringe like a dart so it's easy. You've got total control of it, and you just gently inject that medication down there, and then you'll relax the hold on the testicle a little bit and let the material dissipate throughout the parenchyma, or the tissue in the testicle.
Right.
And then we give the balance of it and pull it out, and that testicle is sterilized. The solution is zinc gluconate neutralized by arginine.
Mm-hmm.
And what that does is it kills sperm on contact. So any sperm it comes in direct contact with in there will immediately be killed. It also destroys the sperm-producing cells, which are the Sertoli cells, and it destroys a percentage of the Leydig cells, which are the testosterone-producing cells. It doesn't destroy enough of those to totally remove the testosterone. So, and when there's not as much need for sperm production, then the testosterone will reduce, so cells will shrink up and not be used for any production to stimulate the production of the
But we're
sperm.
still, so this easy procedure, twilight sleep, it looks extremely easy to do, but these animals are able to keep 50% of the testosterone and hormones instead of the surgery of spaying and neutering, which we talk about all the time, the harm that this can actually bring. So we don't really have the issue of a possible 3 forms of cancer, or the Addison's disease, or the Cushing's disease, or the hypothyroidism, or things like that the University of California Davis report came out with and said these are some main issues when you do a full spay and neuter.
When you do a full spay and neuter, especially at a young age, generally under 2 years of age, and most of them you'll know they're generally spayed and neutered at 6 months of age. That's an arbitrary number. There's a lot of reasons behind that, but it's pretty much arbitrary, because in the smaller breed dogs it's not as significant, but in the large breeds they don't have time to develop.
When you have to close the hip plates, and you need those hormones to close the hip plates.
So,
so we have a bigger issue with hip dysplasia, and I see this all the time. What about ligament tears?
You do. Ligament tears, there's a high incidence of cruciate injuries in these large and giant breed dogs. That usually has been shown to be related to removing those hormones at such an early age. They need those hormones. The closing of the growth plates. These large and giant breed dogs, I encourage people not to spay or neuter them if you're going to do traditional procedures till they're at least 18 to 20 months of age.
Right.
And then, but if you do this procedure, and for the females, we do ovary sparing spays, where we leave the ovaries in and just take the uterus out. But in this case, we leave the testicles in place. The dogs are still the dogs. The one thing I always encourage people to understand, that this is a means of sterilization. It is not a means of behavior modification, but to the extent that removing hormones will mitigate or reduce the aggressive behavior or roaming behaviors and things, this would reduce that as well. But I've said it on this show before, I'll say it again. You do not use a scalpel blade to modify behavior. We don't do it in humans. We don't need to be thinking we're doing it in dogs.
Right. Be responsible for your pet.
That's right. And so what this will do, and you see here, we're putting a tattoo on this dog so that anybody sees him, they're going to go, oh, well, this big dog has got his testicles. He must not be neutered. But the Z indicates it's a tattoo, and it indicates zinc neutering. It's an FDA-approved zinc solution. Sterilization solution with a 99.6% efficacy rating. The only other product that the FDA is giving that to is the human birth control pill. So
how many of those are given out a day?
Exactly.
That's another show.
This is very safe. It's non-invasive. There's no real pain, because when you inject, you saw us injecting there, we're doing it very slow. The reason for that is we don't want to stimulate the stretch receptors around the testicle. There are actually, believe it or not, and most of you men who hear this will go, this can't possibly be true, but hear what I'm saying. There are no pain receptors in the testicular parenchyma itself. Mm-hmm. The pain receptors are in the tunic around, the nerve plexus around the testicle. So when there's an injury to the testicle where it creates pain and discomfort, it's because of the stretch receptors in those vessels in that plexus around the testicle.
Okay.
So what we do is that by reducing the stretching, by putting that in slowly, there's really virtually no pain. And then you might get a little bit of swelling from this procedure. You might get, but the dogs won't. They're not painful. And as a matter of fact, you can palpate them or squeeze their testicle, and they're not going to scream and holler like it's in pain. They might feel irritated or discomfort,
Pressure.
a little pressure that you're putting on it. And, dogs will act like they're in all kinds of discomfort, but they're really not in any pain. And so we give them pain management. We use carprofen in all our cases, non-steroidal anti-inflammatories. We give an injection post-treatment here, and then we send home medication for 3 days to help just mitigate any swelling that might occur in the testicle.
Well, I got to tell you, I actually spoke to Officer Brenda that evening, and her dogs were up and doing great. They were just nice and calm. There's no issues. We now know that they got their hormones. There's life-giving hormones that I'm such an advocate about. Yeah. And they're doing fantastic. And there was absolutely, the next day, she was working with them.
This dog will be up and about in a few minutes, and he'll wake up and walk out of there just perfectly fine.
So you walk in, the procedure takes, 20 minutes?
Yeah, it's probably, what you've seen, it's about 20 minutes.
Yeah, 20 minutes.
I mean, I've had patients brought in, go right to the table. We do a physical exam on them first. We, check all their vitals, and they're all good to go. So from the time we've done that to the time they walk out the door, it's usually 30 minutes.
So you're in and out in 30 minutes. How cost effective is this, Dr. Dan?
Well, it's very cost effective. I mean, this dog right here in many hospitals all over the United States, but especially in North Texas, it'll run anywhere from $250 to $500 to do a standard neuter. And
$500 for a standard neuter,
right,
full operation.
Well, that's full operation. You're using, it's an expensive procedure, and that's why when you go to some of these low-cost facilities, which the Shot Spot where we do this, it is a low-cost facility, but this procedure costs $150 in our facility all in. And then you pay about $20 for the pain management or the non-steroidals. But other than that, that's it. And you're not having to get a cone. The dog doesn't have to have monitoring. We're going to give him a reversal agent here. As a matter of fact, I think I just gave it in this video that I was looking at. And he'll be up. We're going to lay him on the floor, and he'll wake up, and we'll talk to him and blow in his ear, and he'll stand up and walk out of there.
This looks so easy to do, and there's Officer Brenda right there with you.
Yeah, that's the other thing. She could be right there with us. She's well trained in handling these dogs, but I let clients watch and participate if they want to, because it's not a sterile procedure. It's not an invasive procedure. It's just your dog's asleep, and she's going to sit in there and talk to him until he wakes up.
And then he's just going to get up and walk out.
He's going to get up and walk out.
They're keeping their hormones. We're not going to have all the side effects. You don't have all the risk of spaying and neutering. You know what? To me, I just don't know why anyone wouldn't want to do this. This is what we should be doing, in my opinion. And I think if we do this, we're going to have our pets with us a lot longer time. So listen, be sure and reach out to the Shot Spot and Dr. Danny. If there's other vets out there want information, if there's other organizations, or if you want your dog and your cat to live a longer, happier life, we believe that this is one way to actually get there. So if by doing this, I'm so excited about it.
Trust your doctor, trust your veterinarian, and listen to what they tell you. But this is something that I believe wholeheartedly all of my clients are given this option.
A life-giving option.
A life-giving option. And for those of you who show up a little late to the party, who've already been spayed and neutered, don't forget the Gift for Life, because that's how I got involved with Lauriston and the Gift for Life. Is I wanted something for the dogs I couldn't help, the ones that I've seen this so much as they've aged, the issues that occur because of the lack of hormones.
Right.
And this helps to put it back. It's not a panacea. It's not the only thing that's going to ever work, but it is the best thing I have found in my practice to give back those years to these pets.
Well, they start producing through the adrenal cortex up to 24 lost hormones starting in approximately 4 days. We start seeing some results there. But so you can use the Gift for Life, or let's think about that Zinc Neutering. I'm just so excited. So please pass this information on to all your friends, to all your other pet organizations and stuff like that. And let's start talking about this. And I think we can do a better job. So Dr. Danny, as always, thank you so much for showing this. This is exciting, and I know we're going to change a lot of lives. So we'll see you soon. I hope you like all this information. Please pass it on. We love you guys.
Take care.